కానీ మీరు పిహెచ్డి కమ్యూనికేషన్ దాంట్లో కూడా తీసుకోవాల్సింది సార్.
సార్
మీరు పిహెచ్డి డిగ్రీ కమ్యూనికేషన్ వాటి మీద ఇప్పుడు మన కాంటాక్ట్స్ మెయింటైన్ చేయడంలో దాంట్లో కూడా తీసుకుంటే బాగుంటుంది. మిమ్మల్ని
Ravisha madam, it is already live.
Sir, shall I start, sir?
Oh, you can start.
A very delighted morning, one and all. Welcome to the session of day 3 of online short-term training program on role of phytomedicines in global health. And my heartiest welcome to our today's eminent speaker, Dr. Suresh Babu Garu, Principal Scientist, Division of Natural Product Chemistry, CSIR, Indian Institute of Chemical Technology. Now, I would like to invite convener Dr. A. Lakshman Rao Garu to have his words.
Thank you, Ravisha Garu. Eminent speaker of today's session, my good friend, Dr. K. Suresh Babu Garu, Principal Scientist, Division of Natural Product Chemistry, CSIR, Indian Institute of Chemical Technology, Hyderabad. And Dr. P. Ravisha Garu, Coordinator and Head, Department of Pharmacognosy, participants from various colleges. A very good morning to one and all for the third day of 3-day online short-term training program on role of phytomedicines in global health, organized by Department of Pharmacognosy, VV Institute of Pharmaceutical Sciences, Gudlavalledu, Krishna District, Andhra Pradesh, in association with Krishna University, Machilipatnam, Andhra Pradesh. Today, research person Dr. K. Suresh Babu Garu. He is a prominent scientist in the area of natural product chemistry. He will deliver a lecture on importance of natural products and their contribution to health and society. Today's speaker is having a sound knowledge, expertise, and vast experience in the area of natural products. The medicinal use of natural products and compounds that are derived from natural sources, such as plants, animals, or microorganisms, precedes recorded human history probably by thousands of years. Throughout our evolution, the importance of natural products for medicine and health has been enormous. Since our earliest ancestors chewed on certain natural products helps to relieve the pain or wrapped leaves around wounds to improve the healing. And natural products have been the sole means to treat diseases and injuries. In fact, it has only been during the past decades that natural products have taken a secondary role in drug discovery and drug development after the advent of molecular biology and combinatorial chemistry made possible the natural design of chemical compounds to target specific molecules. Natural products are secondary metabolites that are produced and used by organisms for defending or adapting purposes. These molecules were naturally selected during thousands of years to improve the specificity and cover a wide range of functions, depending on the origin, the habitat, and the specific activity carried out in the organism of origin. Due to these intrinsic features, natural products have been used as healing agents since thousands of years and still today continue to be the most important prominent source of new potential therapeutic preparations. Now, I hand over the session to Dr. P. Ravishagaru, coordinator for the online HTTP program, to introduce the today's chief guest, Dr. K. Suresh Babu Garu, to the participants. Over to Ravishagaru.
It's my honor to introduce today's speaker, Dr. K. Suresh Babu Garu. So he was born in Guntur district of Andhra Pradesh, India. He obtained his master's in 1999 and doctorate in natural product chemistry in 2005 from Kakatiya University, Warangal. Later on, he moved to pursue his postdoctoral research at National Center for Natural Product Research, University of Mississippi, USA for 3 years. He returned to India and joined in CSIR service in 2007 at Indian Institute of Chemical Technology, Hyderabad. In his research career, he has been able to successfully carry out extensive basic and applied research in the chemistry of natural products of biological relevance. His research group has successfully isolated several new bioactive molecules from natural resources, and he has published 160 papers in SCI journals and filed 10 patents of India, PCT, and US. He is leading many projects of national importance in new drug discovery, standardization of herbal drugs of commercial importance. His research interests are new drug discovery from natural products, herbal drugs, and their standardization, botanical pesticides, chemical modification of lead compounds, and SAR studies. He is a recognized research guide for doctoral and postdoctoral programs, and 9 scholars are pursuing under his able guidance, and 17 scholars got the PhD degree. His awards and honors are OPPI Young Scientist Award for the year 2010 by Organization of Pharmaceutical Producers of India, Mumbai, Andhra Pradesh Academy of Sciences Young Scientist Award for the year 2010, Best Performance Award for the year 2011 conferred by the Director IICT Hyderabad, elected as Associate Fellow of AP Academy of Sciences in the year 2012, Scientific Consultant to Himalaya Healthcare R&D Bangalore in the year 2015 to 16, elected as a Fellow of Association Biotechnology and Pharmacy in the year 2016, editorial board member of journal Pharmacognosy Magazine Journal in the field of natural products, elected as a Fellow of AP Academy of Sciences in the year again in 2018. 2 patent technologies were commercialized to MS Sami Labs Bangalore in the year 2018. The process technology, development of process for extruded NutraFood products for management of metabolic disorder, anemia, and malnutrition was transferred to Amia Life, the brand of Welfare Life LLP and SDG Healthcare Private Limited, Hyderabad. Now, I invite our speaker to deliver his lecture on importance of natural products and their contribution to health and society. Sir, please, sir.
Yeah. Hello. Good morning to all. So, am I audible?
It is audible, sir.
Yes, sir.
Yeah. Good morning to all for the organization secretary and all those things. And as mentioned, Dr. Lakshman Rao is my good friend, and we are associated from the last 10 years. I have visited your college in maybe in 2012 or 11. I don't remember exactly. From there onwards, we are in touch with for any discussions and everything. Thank you, sir, for inviting me again to your seminar. I always feel Gudlavalleru College is like my home college, and I'm very happy to participate, of course, and I'm also very happy to assist you whenever I am in any requirement regarding the natural products and all those things. And once again, thanks for convener Ravisha, HOD Pharmacognosy Department, for your nice introduction and good words. Thank you so much. Once again, great opportunity for me to showcase my recent work and also enlighten the importance of the natural products, where natural products has been contributed and contributing for the human well-being from since ancient from the ancient times to till date. You can also see many of the drugs whichever is in the present market are directly or indirectly belongs to natural products or its derivatives. That is a fact. We should believe that. And similarly, In this COVID situation, I can say one of the natural product drug, phytopharmaceutical drug, which is in the human clinical trials in association with Sun Pharma and Ayush Ministry and our CSIR lab Jammu. So it is in the clinical trials, phytopharmaceutical drugs, which is working very well. Let's hope for the best to for the well-being of our to combat the COVID-19 disease, and particularly in this present scenario, we are facing, in the presently COVID situation, lock, unlock, and all those things, and we have never expected this kind of situation, and it may be never before and ever after. So it's a dialogue in very common. So we don't know ever after, but it's definitely it's not a never before. I think our fathers or forefathers never seen this type of situation, pandemic situation. And when you believe the olden days are the good days and the days are passing, and there are a lot of changes in the like lifestyle and also in the environment, and all those things are happening. And particularly because of the imbalance in the environment or in the atmosphere, there is a huge changes in the atmosphere, and which generally leads to natural calamities. Because in the earlier days, uh, definitely in the there is a um, different seasons. In the rainy season there is a huge rains and everything, but now we don't know when the rain will come. And also, in the winter time, some temperature, and in the summer, huge temperatures which were not recorded in the earlier times. This is all because of our man-made things only. You know pretty well regarding the global warming and deforestation, removing the forest and planting the small saplings, which doesn't mean, which there is no meaning. So remove the big forest and planting the small saplings, so that sapling has to grow and it become a tree, and it will take another 30 years. So this kind of imbalance is happening in the present scenario. Because of this imbalance, there is a huge challenges in environment. Because of this imbalance, there is a lot of incidents of diseases also occurring. And particularly another serious thing is, uh, particularly in the present society, people are utilizing medicines like a chocolates. Because particularly in the educated people also, some of the educated people also, because they know some they have some knowledge regarding the medicines and diseases. And some of the people will type in Google, and they will educate, they are going to educate, and then they are searching their own medicines and taking like anything. But that is also causing to spoil our immunity and all those things. Because of this also, there is a immunity um, spoiling of our immunity and incidence of other diseases also. Of course, immunity is the first concern to combat any virus or to fight any other virus or bacteria. So similarly, we know pretty well about the SARS, avian flu, swine flu, HIV infections, and presently COVID-19. These are deadly diseases and untreatable global diseases. We know pretty well these some of the diseases were um, and entered because of the some huge changes in the environment and atmosphere, which are done by man-made things. And these are the major killer diseases in the world: AIDS, tuberculosis, diarrheal diseases, malaria, hepatitis B, SARS, avian flu, tobacco-related diseases. You can see here, every year, almost more than million deaths are happening, and more than 1 million uh, new cases are finding. So you can see all the countries, even particularly for all these diseases, there are no globally treatments available for these diseases, particularly in the critical stage. So, and also, as I mentioned, you modern lifestyle of human beings also one of the biggest drawback for unhealthy of human beings. Now, in the particularly in the metro cities, almost to 30 to 40 people are lacking of vitamin D3. Even though our country has blessed with the sun rays throughout the year, where many of the countries did not have this type of blessings, but still we are in the scarcity of vitamin D3 in the particularly in the metro cities and modern cultures. This is one of the pathetic situation we are facing, and also and many of the people they are not following the biological clock, so which really creates obesity and for the other diseases which are dependent upon the obesity and followed by other diseases. So that's what I just wanted to emphasize the about the modern lifestyle is also one of the cause for the unhealthy of the human beings. You can see here the whole family is busy with the cell phones in the sofa. So and the hall, dining hall and TV and all this. So these are we know pretty well, and many of almost all people are practicing this type of lifestyle, and we are much aware all these things. But only thing is we should take care, and our health is wealth, and without health there is no nothing in this world particularly. Okay. And if you see all the situation, definitely there is a crisis for the health in the globally, and for to combat this, getting a drug is to the market is high cost, too costly. Almost it cost about the 1 billion US dollars. Drugs are too expensive, and even though it is costly, see no drugs are available in the critical global diseases. And particularly there is a one disadvantage: if you use synthetic drugs, there is a chance of getting developing the resistance in our body. So in this junction can we think of the natural product based drugs, which are the part of traditional medicines we call. See, in the present situation and the COVID-19, we know many almost in India almost it touched around 30 lakh positive cases, and worldwide almost 2 crores or 3 crores, I don't remember. Even though see people are ready to pay lakhs of rupees, crores of rupees, there is no drug. And now in the coming years, the completely future is vaccines, because now we have realized, we don't know now people are also, and also scientific community and throughout the globally are thinking of on the developing the vaccines for the virus diseases and also other diseases which are in the for the coming years. So, what is a traditional medicine? The all healthcare practices and treatments in the before 19th century fall under the category of traditional medicines, and of course, the raw material for traditional medicine is of course is a plant material, medicinal plants, and this traditional medicine also practiced in the other countries, not only India, but in the different name. It's the term complementary medicine, alternative medicine, non-conventional medicine, etc., used interchangeably with the traditional medicine. Some countries, the raw material in traditional medicine is definitely medicinal plants. So what is a traditional medicine? Traditional medicine refers to medicinal knowledge, innovations, practices practices of indigenous and local communities around the world, and this knowledge has been gained from over the centuries, from forefathers to fathers to son, and all this one. This has been transmitted orally from generations to generation. You can see this type of people particularly in the tribal areas or interior areas of this in the country. Those people are called traditional healers. Traditional healers. Recently, when government of India also conducted a survey regarding the existence of the traditional healers in the countrywide, really it gave the surprising facts. Almost to around 5 to 6 lakh traditional healers are available in the every different corners of the India. So they are contributing. Then really they are serving the interior areas or tribal areas where there is no access for the doctors and for modern medicines. So this traditional medicine in India can be classified into two categories. One is codified and non-codified. codified comes under Ayush Ministry, Ayurveda, Unani, Siddha, Homeopathy, where there is some pharmacopoeias to prepare all these medicines. A non-codified folklore medicine system, still it is being in practice in the interior areas, particularly in the Nalamala forest region and Araku forest region. Tribes, many of the tribes even till today practicing this folklore medicine by based on their knowledge gained from the generations to generations. Of course, these two systems uh, has contributed equally to the primary health care in India. You can see here this picture represents the traditional medicine where this medicine has practicing from the last 4,000 years from our ancestors or ancient time. But still, in the present scenario, based on the revolutionary techniques in biology and analytical techniques and chemistry, pharmacology, whatnot, we can do much better. The only complication with the plant-based medicines is quality control aspect. But however, now in the present scenario, we can do much better to control the to study the quality control aspect. So these are the different OTC counters, over to the counters in the different countries: Iran, Colombia, South Africa, and China. And of course, we know pretty well about the Chinese traditional systems of medicine, which is a very famous and still it is being practiced by the Chinese community. And it's a very well known medicine, traditional medicine. Similarly, South Africa also equally important, have equal importance of the traditional medicine. And you can come across this type of people when you visit the rural areas or tribal areas or forest areas. So still these people are called, say, traditional healers, even though they are not qualified MBBS, RMP, or PMP, whatever you call, but they have good knowledge and they have very good grip on the plants for their usage. What happened, the ancestors or in the ancient times, people did not have any education, they don't have knowledge, but they have awareness of the medicinal plants surrounded by them and where they are living at that time. And based on their knowledge, they have categorized the medicinal plants as a medicinal plants, food plants, and toxic plants. Based on their knowledge, that knowledge has been transmitted to the next generations, followed generations, and then it became a part of their tradition. And finally it has been become a traditional medicine, whatever you call our Ayurveda, all those things has been evolved from that knowledge only. You can call this the same African traditional medicine, Chinese tradition. This is the way the medicine, traditional medicine, has evolved from ancient times to till date. So when you see tribes, India has the largest population of the tribes when compared to any other country in the world. And of course, we have heterogeneous group of tribes, that is different tribes, not the same tribes. And our constitution recognize the 212 tribes found in different parts of the country, like Himalayan region, Northeast region, South region, Western India, and Andaman Nicobar Islands. And these are all different tribes. For example, when you come to in the Nalamala forest, in those tribes are called Chenchu forest. Similarly, the other tribes are different in the particularly in the borders of Telangana and Chhattisgarh. Those calls are Gutikoyas, and similarly the tribes in the Araku region, those are different. So that's what these tribes are, heterogeneous tribes, not homogeneous. And similarly, Andaman Nicobar Islands. Andaman Nicobar Islands, their native tribes are called Andamanis and Nicobaris. And of course now their population is gradually decreasing. And those tribes, still government is taking a lot of precautions to protect those tribes, because those tribes, they do not have they do not know the about the modern world. But those tribes, their entire life spend for on the use utilization of the medicinal plants for food, for their health care, and for their other things also. They are doing pretty well when compared to our modern people, modern human beings. And they are equally good when compared to us. They have two children, and every children, there is a gap for 2 to 3 years. They are well versed when compared to our modern. But only thing is, they have not used our modern medicines, not even paracetamol, not even any single antibiotic, but their average lifetime is higher when compared to modern people. That is a goodness, and that's a greatness of our the and the power of the plant based medicines and the natural products. So based on all these things, recently World Health Organization also conducted a survey regarding the utilization of the medicinal plants for the healthcare globally, not national Indian, globally, and it really revealed the surprising facts that more than 80% world population relied depended upon plant-based traditional medicine for their primary health care. And further, it has listed another 21,000 medicinal plants that have been reported for medicinal use around the world. And when coming to India, always you know pretty well, India is the biggest um, and India has 16 agroclimatic zones, 45,000 different plant species, and among them 15,000 species are well extensively utilized in the formation in the formulations of different traditional medicines like Ayurveda and other systems of medicine. And currently another 5,000 products were included in the pharmacy of Ayurvedic treatments. So these are the majority of the natural sources: plant kingdom, microbial world, animal sources, marine world, venoms and toxins. In the initial remarks, Dr. Lakshman Rao mentioned about the importance of the natural products and contribution. Here, among these natural sources, plant kingdom has almost contributed a lot to the human beings in the form of the Ayurveda and all those things. And similarly, microbial world. Best example is penicillin. And when you similarly, if you see other sources, marine world is a you if you see the majority of the antibiotics and anti-cancer drugs and all those things were derived or originated from the marine world. And venoms and toxin animal sources, there are some drugs also available based on the sources. That is the importance. These are the major sources. And in my presentation I will also give emphasis on the other sources called lichens, which is also good source, but very those are very less explored. So I want to explain that source in the coming slides, in the end of the slides. So different applications. If you see different applications of the natural products, you can see natural products are very much applicable in herbal medicines, pharmaceutical applications, and food and feed, and pesticides and cosmetics. For a glance, here I gave some of the molecules which are in the present use by the industries for different applications. You can see artemisinin. We are very much well known about the artemisinin, which is a well known anti-malarial agent, and ivermectin B, crop protectant. Similarly, rosmarinic acid, very well-known food preservative, and trapaxin B, biological probe. Similarly, epigenin, very well-known colorant and extensively used by the industry people for colorants. And similarly, linolol, very well-known agent for the perfume industry. Similarly, stevioside, artificial sweetener, derived from Stevia rodendiana. And linoleic acid, this is also very well known in the cosmetic industry. So these are the simple examples to explain about the natural products and its applications. And why the study of natural products. And these natural products are the source of most complex and fascinating chemical structures evolved by the defense mechanism from its original source. And the natural products represent the biological diversity, and these are expressions of genome. And it's also represent the natural biological activity, whether single molecule or complex mixtures. And also, natural products are the part of natural wealth of the country and can be important source of livelihood from agriculture to food, pharmaceutical, fine chemical industry. And natural products can be effective bridge from tradition to modern scientific developments, including genetics, molecular biology, biotechnology, and pharmaceutical science. And the utilization of the natural products has been reported in the ancient times, and particularly the therapeutic use of the plants can be traced back to the time immemorial. That is the earliest records of the Mesopotamian civilization, almost in 2600 BC. And the use of medicinal plants by Egyptians is recorded almost 1500 BC. In this therapeutic application, more than 700 drugs were documented. Similarly, the very famous Chinese medica can also be traced back 1100 BC. And these are traditionally established by our system Ayurveda. You know pretty well about Ayurveda. Ayurveda is a long system of established system of medicine practiced in India for thousands of years, and now it is getting worldwide attention as an alternative systems of medicine. Even though Ayurveda and other traditional systems speaks about the crude extracts and crude fractions, but not about the single molecules. However, this knowledge give a base for the discovery of many of the lead molecules which are in the present market. And this is one of the important application and important knowledge and important platform Ayurvedic knowledge, because based on this only many of the leads were discovered. See, these are the different leads have been discovered, and these are very well known leads, and which are in the part of the formulations of different diseases. So here Rauwolfia alkaloids to reduce hypertension, Rauwolfia serpentina. Similarly, soralins derived from Soralia corifolia, which is very well used in the removal of vitiligo. Similarly, Olar henna alkaloids, Olar henna dysenteria, raw material name, and used for amoebiasis. Similarly, L-dopa mucuna which is well known for Parkinson disease. Piperidins derived from Piper species, well known as a bioavailability enhancer. Similarly, picrosides derived from Picrosia currora, and a very well known formulations of different uses. And similarly, Philanthus, well known as antivirals, curcumin, curcuma longa. Similarly, vithanilides, and this which contains related to the steroidal lactones and glycosides, very well known as immunomodulators. Similarly, economically affordable and easy procurement of the raw material, and comparatively low toxic, and these are very effective in the chronic diseases. Here, regarding the toxicity, I would like to share one example, one incident, you can call it. Actually, one of my friend is working as a degree college lecturer in the some degree college. So he is suffering from diabetes from long time, I think 6 or 7 years. So he was told by his friend that why don't you use Naxwamika? You take Naxwamika bark, put it in the glass of water while going to bed, and the next day morning you take that extract or water. So you will be cured like anything within short time. So that is nothing but water extract of Naxwamika bark. And we are very much aware that Naxwamika capsules are very famous in the homeopathy for diabetes. Similarly, Naxwamika fruits, strychnos Naxwamika fruits are toxic, which are in use of mixing with monocrotophos to spray in the paddy fields for as an insecticide or um, um, and so. But Naxwamika bark is reported to for even diabetes. So what my friend did, so by excitement, he has taken more bark and put it in the big glass of water, and next day morning he drank that water. What happened? He was hospitalized. See, that means he has taken more doses. Dosage is also one of the important factor in the utilization of the plant medicines. You have to take the prescribed dosage only where the body accept. If the body did not accept, then you will be hospitalized. So that is an important aspect. Even if you take more dosage, that leads to the toxicness also. So even if you take more food also, that will become a toxic. And the not only the Ayurvedic concept, Ayurvedic knowledge become the platform for the discovery of many leads in the and also it also has the application in the other fields, medicine field, where it can be evidenced in the Nobel Prizes in 2018 and 2016. You can, if you can see this, the theme or basis for this Nobel Prize also directly linked to the our Ayurvedic concept. Here in 2018, for their discovery of cancer therapy in inhibition of negative immune regulation, which is almost related to our Ayurvedic Vata Pitta Kapha. Here in 2016, for the discovery of mechanism autophagy, which is nothing but our Ayurveda fasting, concept of fasting. In Telugu, it is called Lankanalu. So that is the importance of Ayurvedic concept. Really, there is a huge opportunities to work on this pharmacognosy field, either you call pharmacognosy or natural products. Still, there is a lot of flora available in our country to explore or to get scientifically validated to combat the human diseases. And this is one of the classical example, very well known for every Indian. Uh, to to just to give the importance, just I put this slide. You know pretty well about the Sanjeevani mountain, where the Hanuman has carried the Sanjeevani Parvat to save the life of Lakshman. And there are thousands of this type of Sanjeevani medicinal plants are available in our country, particularly in the hotspot, biodiversity hotspot. This is also one of the good opportunity for the youngsters. I can call them as the young stars, not youngsters. So they are the stars of our future, to work on this area and to strengthen this area where there is a huge importance for this kind of natural products. So when you see about the biodiversity, almost among the 34 mega diversity hotspot in the globally, our country hosts three places. One is the Himalayan region, Western Ghats, and Indo-Tibetan region. In these three places, many of the tribal people are existing, and they are using these medicinal plants. And many of the medicinal plants are not even identified taxonomically, and they are using this medicinal plant for their health care. And also, particularly in the Indian Indo-Tibetan region, Northeast region, these medicinal plants also became their livelihood, for their well-being, in the form of livelihood, and also their for their good health care. So this is also, that's what I am emphasizing. These areas are containing many of the medicinal plants for the exploration. And if you see the India's strength in the herbal technology, almost 10,000 species are categorized in different categories: edible plants and fiber plants, pesticides and gums and resins. And when coming to utilization of the plants in the traditional systems, Ayurveda, Unani, Siddha, and Amchi, this is a Tibetan based medicine and modern medicine. So more than I mentioned species, this is the old data, maybe now it may be more also. So that's what, even in modern medicine, if you see, for dengue fever, only till date, only the papaya leaves are the only remedy. There is no modern medicine, there is no allopathic medicine. Similarly, there are different even antifungal therapy, amphotericin B, which is called as a gold standard. That is the only source. Similarly, caspofungin in the antifungal therapy. These are all gold standards which are only derived from the natural products. There is no other source. And if you see the number of molecules or number of new chemical entities marketed from 1981 to 2014, almost 1556 molecules were marketed, which are almost based on either new direct to few pure natural products or its derivative. So, and they have contributed in many fields like antibacterial drugs, anti-cancer, and hypertensive drugs. When you see this picture, so till date, only this 10% natural flora has been explored. The remaining 90% gold mine has as it is. So this is one of the good opportunity to work on this area. And when coming to uh, the microbial natural products, only less than 1% has been explored till date, and the remaining 99% is waiting for really for to work by the young stars. So here you can see the contribution. Almost 78% of the molecules are antibiotic drugs are from natural sources, and similarly 74%, almost 79 new chemical entities are anti-cancer drugs, anti-hypertensive 47%. Among those 75% new chemical entities, still as I mentioned, amphotericin B, which is called as a gold standard in the antifungal therapy, and the lipopeptide caspofungin are derived from natural products. So these are the some drugs, world's best selling pharmaceutical derivatives from natural products. Here I listed some, so I'm not going to. And when coming to the categorization, based on the quality, the plant based or herbal medicines were categorized category 1, 2, 3, and 4. Category 1, the category 1 falls under the folklore medicines where there is no scientific evidence, there is no quality control aspects, nothing. Category 2 comes under Ayurveda medicines and all those things, documented herbal medicines in treatises or books, which where the medicines has been prepared by using the pharmacopoeias and all those things. Category 3, modified herbal medicines where some sort of safety and efficacy data involved. And category 4 has completely imported herbal medicines where both countries are registered and safety, efficacy, and all quality control aspects should be there. Then only that will fall under the category 4. And similarly, if you see about the utilization of the plant drugs in international care internationally, so you can see here more than in developing and developed countries, more than 40 to 50% people are using, and also it has also become a good. They are also realizing huge money, huge capita by from the industries in different countries, US, UK, and Australia, and developing countries, Malaysia, South Korea, and African countries. But of course, the name may be different. If you go to US, then those names are called botanical drugs, and in Europe, those are called nutraceuticals. But in our India, it's called herbal drugs. So, what are the constituents in the natural products? How they are responsible for to combat the different diseases? Natural products contains primary metabolites and secondary metabolites. These primary metabolites are itself useful for the plant or marine, whatever it is. It's and later it is converted into secondary metabolites. These play a role in the organism reproduction and growth of this particular organism, and they exert their biological effects within the cell organism that is responsible for their production. Examples are proteins, carbohydrates, lipids, and nucleic acids. And of course, in very few cases, primary metabolites are part in the some of the formulations of Ayurveda and other traditional medicine. And these secondary metabolites, these are the main constituents and which are main bioactives which are responsible for the activity. So, and many of the times the secondary metabolites are evolved through the chemical defense, and these are highly useful for the organism production defense against the herbivory and other interspecies mechanism. These are different class of secondary nitrogen containing compounds, phenolic compounds, terpenes. We know pretty well importance of the alkaloids because many of the drugs in the present market are containing the nitrogen or heterocyclic atoms, and those are very important drugs. And similarly, phenolic compounds also plays a vital role, and which are very well known as antioxidants or nutraceuticals. Anthocyanins, salicylic acid, lignans, tannins, and ellagic acid. Terpenes, limonoids, and azadirachtin is a very famous insecticide derived from neem tree. Saponins, pinene, camphor, and other pinens. So there are different classes. Just for a glance, I put one slide on different classes of secondary metabolites, and every secondary metabolite has evolved through its biosynthesis in the plant itself, and every class of compounds have their separate biosynthetic pathway where these compounds are synthesized in plants by its biosynthetic pathway through the enzymatic pathway, and all those things. These are polyketones and fatty acids, terpenoids and steroids, phenylpropanoids, alkaloids, and specialized carbohydrates. And the terpenes are classified by the number of these C5 isoprene units that they contain. These classes are monoterpenes. If two isoprene units are there present and called monoterpenes, sesquiterpenes, and diterpenes, and other. If you see the evolution century to till date, in the 1800th century and in the year 1800s, there is no technology and no techniques for the even characterization of the pure compound. Of course, they used to characterize those compounds by physical parameters and also some sort of chemical reactions, and keep on evaluating and keep on coming. In the 19th century, there is a revolution in analytical technology, biological screening, high throughput screening, all those things, and spectroscopic studies are evolved from ancient times to now. And there is a huge spectroscopic technique, analytical techniques, and hyphenated techniques, and high throughput screening, whatnot. Everything is available, and we can all techniques were evolved from time being from 1800 centuries to till date, and even hyphenated techniques, MSMS techniques. Now you can characterize by using ppm level of compounds in by using different techniques, hyphenated techniques. And if you see the success history in early 1800 centuries, based on those their knowledge, they have been first to discovered is a morphine, and later based on these isolations, first to developed commercial pure natural product by E. Merck in 1826, and first semi-synthetic drug was aspirin by Bayer in 1899. Similarly, there are some milestones in the natural products. We know pretty well about the penicillin, where it has been discovered in 1929. So after that, majority of the antibiotics were discovered between the years 1940 to 1970s. That's what this 30 years period is called golden era of antibiotics. And those are best examples: tetracyclines, streptomycins, doxycyclines, and lipopeptides. And when coming to marine environment, exploring the marine environment, marine flora has begun from 1970s onwards. So if you these are the majority steps involved from the drug discovery aspect from the natural sources. So where bio raw material, prepare the extract and isolate the pure compound, bioactive NCE, and develop the libraries and heat to lead compound, and finally after passing all the clinical trials, it will become a drug candidate. We know the raw material may be different raw material: plants, fungi, insects, marine microbes, as I explained in the first slide. And extractive, there are a lot of extractive techniques are available based on the compound nature. Extractive techniques will be adopted. And similarly, chromatographic techniques, there are a lot of chromatographic techniques available based on the nature of the compound. And for spectroscopy also, a lot of evolutionary techniques have been available in the present scenario. And synthesis and drug candidates, these are the major crucial steps in three steps in the drug discovery of natural products: identifying the heat and heat to lead, and finally lead optimization. These are crucial steps in the drug discovery. And if you see the technology drivers in the natural product chemistry, always the basis is traditional knowledge and folklore medicine and phytogenic serendipity. And after that, they keep on moving to the different steps: high throughput screening, targets, dereplication technology, and even purification technology, finally optimization development. Recently, there is a and of course this has been contributed by the analytical, supported by analytical techniques, hyphenated NMR techniques, hyphenated HPLC techniques, and hyphenated MS methods. And recently there is a one developed 3D NMR technique for the structure determination of peptide natural products. This is a recent technology, evaluated technology, 3D NMR techniques. We know pretty well about 2D NMR, 1D NMR, but this is 3D NMR techniques. And I gave here reference JOC. You can refer if you may if any interested. And the role of natural products in the present in the today, nature still holds many secrets which we can learn from the chemical structure, biosynthesis, and the role and relationship of the plants to the other organisms. The study of the natural products merges science with the culture, and for countries which harbor rich biodiversity, the study of natural products is an important way of developing one's natural sources. And natural products should use the and or should adapt the new developments or new technology to discover more new chemical entities, particularly molecular biology, computational science. And of course, natural products chemistry is a multidisciplinary activity, and it involves Ayurveda knowledge, folklore medicines from folklore knowledge from folklore healers, sociology, cancer biology, taxonomy, bioinformatics, ethnobotany, neurobiology, whatnot. It's a multidisciplinary activity. And of course, there are a lot of challenges and issues in the natural products chemistry today. Loss of biodiversity, as I told you in the beginning, there is a huge removal of the plants and removal of the medicinal trees in the forest. That is a lot of biodiversity and IPR issues. And similarly, biopiracy and Western drugs, high cost of drug development and new drug leads and targets, and herbal products particularly. There are a lot of quality control aspects involved in the herbal products, and illustration of the mechanism is little bit tough, and also it's a burning area for research in the present scenario. And the research areas, when coming to research areas in the natural product chemistry or natural products today, structuralization is one of the heart area and heart area also in the natural product expertise. And metabolomics and synergy and biotransformation, biosynthesis, biological activity, and of course molecular biology and biotechnology, and most importantly, quantitative natural product chemistry, where analytic related to the pharmaceutical analysis of the herbal drugs or quantification of the markers in the multi-herbal formulation is a very good area to take up as as their research career, because very few people are existed in the present market or present industries to work on this herbal product analysis part of the herbal products. Because if you can develop your own expertise, if you are capable of doing getting the separation or developing the methods for separation of n number of compounds present in the crude extract, it is pretty easy to develop a method for synthetic drugs where two or three or four maximum. So when you are capable of doing all those methods, and you are a star now. And even to work in these areas also, industry is also paying good remuneration for this area. And there are, of course, there are different challenges available in the present today. We can natural products industries are not competitive when compared to the big pharma. There are a lot of issues are involved, particularly for the taxonomy. Even day to day people are disappearing, and the expertise of taxonomy is disappearing. There are a lot of issues and a lot of reasons. Similarly, quality of the plant material is also one of the biggest issue, because of loss of biodiversity. And the natural products prioritization and problem related to the isolation process. It is well known that isolation process is a tedious process. It takes a lot of time. And even for the research scholars also, many of the research scholars are now reluctant to take natural products as their career, because it involves a lot of work. But it has a good career, that's what I can assure you. And it's a upcoming career, and definitely you will see the in the coming years, there will be a more important will be given to natural products practicing people. That's what I can say. And what are the extraction? Just extraction and analytical techniques in the natural products. As I mentioned you, there are different analytical extraction techniques, classical techniques or advanced techniques you call. And there are different techniques are available: plant tissue homogenization, maceration, infusion, percolation, digestion, decoction, oxalate extraction, and sonication, supercritical CO2 extraction. Every technique has its own significance, and based on the compound's nature, all these techniques will be adopted. And similarly, chromatography techniques for the purification: thin layer chromatography, HPLC and HBTLC, gas liquid chromatography, and high performance liquid chromatography, ultra performance liquid chromatography, gel filtration chromatography, paper chromatography, and so on. There are other techniques also available. As I mentioned you, based on the compound's nature, the all the techniques will be adapted for the time being. And spectroscopic techniques for the characterization, and NMR is the main technique for the characterization of the compounds isolated from different plant extracts. NMR is the study of interaction of radio frequency of the EMR with the unpaired nuclear spin in an external magnetic field to extract structural information about a given sample. And there are 1D 2D NMR techniques are very well known, and recently, as I told you, 3D NMR technique also evolved. And 1D NMR, from 1D NMR technique, proton and C13 NMR, where we will get the information about the number of protons and the number of carbons from carbon 13. In two-dimensional NMR, we will know from that spectra the adjacent to proton, that is proton cozy adjacent protons. And similarly, the nosy and HMQC HMBC, from HMQC we'll know about the information which carbon is attached to the carbon proton assignment. Similarly, HMBC carbon carbon linkage. So these are all techniques available in NMR. The other spectroscopic methods: IR, UV, and mass. We know pretty well IR is the spectroscopy technique where it will give the information about the presence of the functional groups, that is functional group present in your compound. Similarly, UV speaks about the chromophores or conjugated double bonds present in your sample. And GCMS mass technique will give the molecular weight or molecular ions or fragmentation ions of your sample. Particularly GCMS deals with about the volatile compounds in your sample. And in the mass spectrometry, there are different ionization methods which can be or which will be adopted based on the your compound nature or compound molecular weight. For example, electron impact EA mass will be for low molecular weights and low volatile compounds. Similarly, chemical ionization, ESI mass, electrospray ionization technique, and Fab mass, particularly Fab mass, will be used for the characterization of the polymers or peptides. And similarly, MALDI-TOF also useful for proteins, peptides, and other complex molecules. So, for a glance, I gave the traditional procedure for isolation of natural products, where the right side pictures are from our lab. So, you take the extract and do chromatography, generate the fractions, and again subjected to activity and take the active fraction, do chromatography and isolate the pure compound. And further, it will be elucidated structurally by using different spectroscopic technique and activity confirmation. It may be our new, we don't know, based on the literature, based on the structure we can decide whether it may be new or known, uh, based on the input from the literature. So this is a tedious process. And now there are new recent techniques are available by the intervention of the advanced analytical techniques, LCMS, GCMS, or NMR. So you can use these techniques in the for dereplication as well as for identification, and for the preparative column chromatography, and further by generative to characterize those ppm level compounds by using their mass fragmentation pathway. So these are latest techniques and dereplication strategies based on these sophisticated instruments. So these are the main approaches in the natural product drug discovery. First one is bioassay guided approach. It is a very well known approach where many of the drugs in the present market are evolved through this approach. And the reverse bioassay guided approach, this is nothing but the normal, you isolate the compounds as many as, and later you submit screen for the activity. So this is opposite to the bioassay guided approach. This approach is also one of the important, equally important compared to the bioassay approach. Similarly, the NMR based approach and mass based approach. So to reduce the time and to identify the more number of compounds, the intervention of NMR and mass is very important. And this is one of the recent approach in the natural product drug discovery. Similarly, metabolomic based approach, this is nothing but biochemometrics, and molecular networking based approach. This is almost related to the artificial intelligence. So based on the mass fragmentation pathway, it is connected to the global natural product server, GNPS. So if you develop the mass fragmentation or total ion chromatography of your extract, so it will, the global NPS server will give the information about the known compound and new compound. So based on that, you can characterize those compounds, and easily you can differentiate the known and new compounds. So I would like to emphasize few drugs of different sources: terrestrial, marine, and lichens. And later, I will show some of our laboratory results by using these approaches for lead compounds. First, drugs from the terrestrial plants. So we know pretty well about the artemisinin and its history. So, and also we are very much aware that the for the discovery of artemisinin, Professor Yo-Yo Tutu, this lady got Nobel Prize, shared Nobel Prize with other scientists in the 2015. Artemisinin is isolated from Artemisia annua. It belongs to Asteraceae family in 1972. Extraction was done in the low temperature, that is diethyl ether in low temperatures. The plant is selected based on their traditional knowledge, traditional Chinese medicine. And artemisinin is structurally highly oxygenated compound, sesquiterpene lactone containing a trioxane ring system with endoperoxide bridging. And this compound was found very effective against the chloroquine resistant malaria parasite, and it kills the parasite during the early stage of its development, which is responsible for the unprecedented success of this compound. And later, after discovery of artemisinin, few modifications were done on the basis on the base artemisinin structure, and prepared two derivatives, artiflin and artether, to to improve the efficacy and also the selectivity. So these two derivatives also approved for the malarial drugs, and also present in the present market. Uh, Similarly, Toxal is called also Faclitaxel, and this is isolated from the bark of Taxus brevifolia and named in 1967. And its mitotic inhibitory activity of Taxal was discovered in 1967. And when it was developed commercially by Bristol Myers Squibb, the generic name was changed to Faclitaxel. And Faclitaxel is now used to treat patients with lung and other cancers, and it is approved for different line of cancers and different combination of drugs cisplatin 1998, 99, 97. And since this taxol is scarcely available in the plant, so definitely it should be produced in a lot of tons for the to produce in the pharmaceutical level. So for that, a semi-synthetic route was developed by using its one of the ingredient 10-deacetyl baccatin, which is a again the natural source and abundant source in the plant. And by tagging this synthetic fragment to this, then Taxol has been prepared, and till date this is the only procedure for the multigram or ton synthesis of the Taxol. Similarly, vincristine and vinblastin, very well-known anti-cancer drugs, and very well-known vinca alkaloids, vincristine and vinblastin isolated from Catharanthus roseus, that is called vinca, or also known as vinca rosea. And both these drugs are dimeric indole-indolin alkaloids, in which the catharanthine system is bonded in the single bond, and widely known agents for chemotherapy. And this plant is also very well known as a traditional medicine. And this vinca rosea is widely used for the treatment of diabetes in various traditional systems of medicine. Based on this vincristine and vinblastin, the chemical modifications were done and to prepare the other derivatives to improve the efficacy and selectivity, and the vindosin and vinloberin and vinflunin. And these all derivatives also in the approved by the different agencies FDA approval in different years for the treatment of the different cancers. Similarly, other known compound camptothecin and photophyllotoxin. We know camptothecin is isolated from Camptothecea acuminata, a native of China. Similarly, photophyllotoxin belongs to lignan class of compound, and isolated in 1880, and its structure was confirmed in 1950. You can see the difference, 1880 and in 1950. So they have taken lot of time, particularly in that 19th century, there is a lack of technology. So that's what they have taken a lot of time for the confirmation of the structure. And based on these original molecules, many derivatives, etoposide and tenopside, has been developed by tagging different glycosides and other heterocyclic rings. These two important anti-cancer drugs also derived from photophyllotoxin, and these were approved by FDA in 1996 for different cancers. So there is and just to I will speak about the quality control aspects of herbal drugs, because we are pretty much known about the quality control aspects or adulteration of herbal drugs, and the therapeutic activity or therapeutic effectiveness of the formulation depends upon the bioactive molecule present um, in the formulation or plant or extract. Those are nothing but secondary metabolites such as alkaloids, glycosides, saponins, coumarins, flavonoids, and other terpenes and not whatever. Almost 75 to 80% of the medicinal plants required in traditional medicine is collected from the wild source, and however, its long-term supply of quality raw material is therefore difficult. And nowadays, many of the herbal industries are taking the lease land in different states and cultivating their whole now they own herbal plants to prepare the herbal formulations. And the majority of the 35 to 40% of the medicinal plants in traditional medicines are cross pollinated species, and hence there exists a vast intraspecific genetic variability, and the variation of this plant cross pollinated species also affects in the efficacy and also their toxicity. And heritability of these compounds are controlled by the variety of the factors like genetic factor, micro and microenvironment, season, stage, growth, and development of the plant. So these factors are also important to quantify those medicinal plant species. For example, if you prepare the Chavan Prash by those plants grown in the Vijayawada or Gudlavalleru surrounding plants is different from the Chavanapras prepared from the Himalayan region plants, because Himalayan region is a cold temperature, high altitude. Definitely, there is a variation in the quantity and quality of the constituents from those plants to these plants. So definitely, that's what the every plant or every constituent has to be standardized irrespective of their quantity, and it has to be standardized in different, and also optimize those formulations and optimize those plants in different species, different seasons based on the environment, and lack of the consistency in quality in batch to batch production of the products, and the lack of a well defined and well orchestrated SOPs. You know pretty well, if you take any Dolo 650 or paracetamol 650, irrespective of the company, the dosage is 650 only. So it will never cross than that dose, but it's not happening in the herbal drugs. The marker compound or active compound is not in the constant ratio from one batch to one batch. That is the main drawback in the herbal drugs. And similarly, based on the importance of natural products, many of the adulteration is happening in the present scenario. Just I would like to quote one incident. One of our senior colleague is suffering from arthritis. Sorry. So he's a basically Maharashtrian based. So he went to his native place. He has been told by his villagers, sir, you use this plant extract, or so you will get relief from arthritis immediately. So he believed that those people, and he has been used for a couple of weeks, and came back to IACT and went to the dispensary for a regular checkup. He told the same thing to the doctors. I am using this allopathic medicine from long time, but I am not getting relief. So immediately I got relief by using this. So we got it out, and by virtually that medicine came to me. Since I am working in this field for testing of steroids, that medicine contained lot of steroids. So he stopped that medicine. Again, after a month, he went to some Unani based doctor, Hyderabad based Unani doctor, and he got green pills. Again, he has taken that pills for a couple of weeks. So this time also he got very good relief, and I analyzed those Unani pills, but this time there is no steroids. But by exciting, I developed a HPLC and HPDLC method to know about the constants percentage. So very surprisingly, I came to know that that pill contains 80% of diclofenac sodium, which is allopathic medicine. So what he did, so he has purchased the tablets from the medical shop, and he made a powder, and just he added some plant extract which is not toxic. So this type of adulteration is happening in the present society. So definitely we should take precautions while using herbal medicine. There are different aspects in the standardization of the herbal medicines. So these are the different aspects: physical parameters, chemical parameters, biological, botanical. In botanical, there are microscopic and macroscopic. The physical parameters, moisture value, ash value, extractive value has to be checked out. The raw material should be free of pesticidal residue and free of heavy metal residue, and also the raw material should be free of microbial contamination, and pharmacological evaluation toxicity has to be performed. In the botanical, the plant, even some of the companies, some of the herbal industries, if the original plant is having the scarcity, they are using the synonymous plant to the original plant in their formulation based on the demand of that formulation. So in that case, it should be completely characterized by using the microscopic and macroscopic techniques. So these are the analytical techniques for characterization of the herbal medicines. FDA approved analytical techniques: HPLC, HPTLC, UPLC, LCMS, and GCMS. Every technique has its own significance in the analyzing the plant-based extracts and plant-based medicines. So I will show one of the our recent work in this area. So this is plant called Sasuri alapa, very well-known plant, and part of the many formulations in the traditional formulations. And if you use this plant, these two are the costinol and dehydrogenase. These two are the marker compounds we have identified and from this plant. So when you use this plant as one of the ingredient of the formulation, definitely these two marker compounds should be present. Then only it is a quality formulation. So that's what we have procured the Sasure Lappa plant, and we have quantified these two marker compounds in the raw material and the extract, and based on our own developed HPLC and HPTLC method. And further moving ahead, we also purchased different herbal formulations of different vendors, and we analyzed whether these formulations are containing the marker compounds, these two marker compounds, and fortunately some are in the detectable limit and some are in the non-detectable limit. Further moving ahead, because stability of the marker compounds or active compound is also important, because our intestine contains acidic environment and other environment. If our marker compound is not stable enough in the acidic environment, so it may decompose to the other compound. If the compound the other compound is stable enough and non-toxic, then we are fine. Otherwise there is a huge adverse effects. That's what we studied the stability effects of these two marker compounds in stress behavior. Fortunately these two compounds are stable enough. Just I will also give some few drugs of marine environment. We know pretty well our country has a long marine region of different environments. Here you can see flattened sea and the sea between the two hills, and here sea between sea surrounded by the hill, and here also. So based on the different environments, the marine flora also become a diverse, and which finally become a synthesis of many diverse chemical compounds. The sources of marine drugs, there are a lot of marine sources are available: sponges, colintricates and tunicates, and echinoderms, bryozoans, and wide variety of microorganisms in their tissues. So these are some of the I listed here: sponges, molluscus, and tunicate and bryozoa. And these marine species, I think, have a lot of diversity of the chemical compounds. And why marine sources? Traditional sources are terrestrial plants and animals. The high level biodiversity in the marine world based on the different marine environments, and high level biodiversity means high level chemical diversity and variety of molecules show unique structural features, exhibit various types of biological activity, highly potent biological active molecules. If you see the present antibiotics, anti-cancer drugs are almost majority of the drugs were derived from marine sources. Definitely there is a marine environment always
So in
associated.
the course home page, what I'm going to do is,
Hello,
this is my course plan.
hello, yeah, am I audible?
Oh, it is audible, sir. You can continue.
Yeah, some disturbance is coming.
Yes, sir. The registrar sir is going to join. That's why. Okay,
Yeah,
you can continue, sir.
yeah, okay. It is well known that always marine environment associated with the different animals. Definitely, there is a competition for each animal for their survival and environmental pressure, which leads to biodiversity, and finally, the biodiversity leads to the defense attacking signaling, which leads to the chemical diversity. Finally, leads to the synthesis of the potential new drugs. So here I will give I give one small example. There is a one animal called sea cucumber. Sea cucumber, where the sea cucumber travels only 100 meters per a day. When the sea cucumber is surrounded by the animals or other animals to are enemies, the sea cucumber instantly prepare some chemicals and spray against the enemies to protect itself. So that is nothing but the defense signaling attack. So during the defense signaling, it itself prepare the sometimes some type of harsh chemicals or toxic chemicals. That's what always marine is a good source of toxic and potential chemicals. So marine organisms are soft-bodied or live a sedentary lifestyle, necessity of chemical means of defense for the to survive itself, and evolution of ability to synthesize toxic compounds instantly. Many natural products from these organisms act as a chemical weapons and are highly potent inhibitors of physiological process in prey, predator, or competitive, and several show pharmacological activities and are active, effective against the cancer, AIDS, and arthritis, and highly potent. Sorry. So, just I would like to emphasize two or three examples, important drugs of marine origin. This is called zinconitide. Zinconitide. This is derived from the toxin cone snail, Conus magus, first drug of marine origin, which obtained approval FDA in 31st 2004, and it is the most powerful painkiller to date. And then another important compound, holicandrin B. This is discovered from the marine sponge Holicandria ocadia in 1985, and it is shown moderate activity against the breast cancer cell lines. And after the pruning technology, they have prepared they have truncated this, they have cleaved this ester bond and developed this compound called erubulin, and this is the one of the most effective anti-cancer drug towards the breast cancer, and recently it has been marketed through the trade name of Haloven, and till date this is the most costliest drug. Almost one injection is costing about the 5,000 US dollars, and mostly costly drugs. And now Indian pharmaceutical companies are now focused. Cipla, Sun Pharma, and other companies are focused by to prepare this compound in the multigram scale and in the quintas level, and it is working in the picomolar level, and also most costliest and most expensive technology. And similarly, bryostatin, a microlactone isolated from the marine bryogen, and it is also approved in different phase studies and in combination therapy and also other cancer and kidney therapy. And here I gave some of the examples of anti-cancer candidates, antifungal candidates, antiviral candidates derived from marine environment or different marine sources. So lichens, as I mentioned you, lichens is a very good source and not explored much in the terms of the now, phytochemically and other utilization. Even the lichens, what are the lichens? Lichens are the symbiotic organism with algae and cyanobacteria. Because this is a symbiotic bacteria, so you can see this type of this is the lichen which grow on the rocks and trees of the non-polluted areas and moist areas. Lichens also has a history of their utilization in ancient times, like our plants and other natural sources. But however, there is no drug evolved from the lichens till date, and lichens also known to possess this type of all the activities: herbivores, antioxidant, and pollution tolerance, allergens, cytotoxic, whatnot, everything. But majority of the lichens are utilized or in the combination of drugs, particularly in the cosmetic drugs. If you see the lichens reaches in India, lichens are also known as a pollution indicators, where lichens grow in the non-polluted areas and moist areas. Here you can see Himalayan region, east northeast region, and middle region, and eastern Ghats and western Ghats contains the lichens. And as part of our program, we initially focused on the Eastern Ghats, particularly in the Rayalaseema region, Harsley Hills, Anantapur, and Kadapa districts, and we collected some lichens and worked on. If you see the lichen diversity, Tamil Nadu seems to be the richest in the lichen, and followed by the other states: Uttarakhand, West Bengal, Sikkim, and Arunachal. And coming to our own research, as I mentioned you, as part of our division Center for Natural Products and Traditional Knowledge, we regularly interact with the tribal people or traditional healers or folklore healers in the different areas of the country, and we understand their knowledge and identify those plants which are in the part of folklore medicine, and come back to the lab, and we take up those plants to validate scientifically and to isolate the active compounds from those folklore medicinal plants. And after isolation the active compound, we are also involved for the simplification or chemical modification to take that lead compound as a clinical drug candidate. And after that, we are also able to identify active pharmacophore which is responsible for the activity. Based on that, the library of the compounds will be synthesized and screened for the activity. So these are the different targets we are working: anti-cancer, antifungal, anti-diabetic, free radical scavenging activity. And in agriculture side, mosquitocidal and insecticidal. In the applied side, we are actively involved in the standardization of the multi-herbal formulations, and the majority of the times these projects were taken by from different industries. And the process development of the active compound from the crude extracts and pilot scale of isolation of the active compounds. And nowadays, majority of the agencies, FDA and other agencies, also stressing the companies to develop the fingerprinting profile of the herbal drugs and also other drugs. HPTLC is one of the advanced equipment for development of the fingerprinting profile, and also identification of the impurities and markers for herbal drugs and other pharmaceutical drugs. This is a new drug discovery process in the IACT in our institute: extraction, evaporation, separation, and high throughput screening and dereplication technologies. And our approach, as I mentioned you, we are working on different natural resources: plants, terrestrial plants, marine, and lichens. So we are also working on repurposing of the known compounds for different targets, and also chemical modification to add value to known compounds by preparing the different derivatives. Finally, all the compounds will be screened for biological targets, and based on the activity, and the IPR will be generated, and it will be taken to forward to take it as a new chemical entity or drug candidates. So I will give some of the lead compounds obtained from our lab by using different approaches: biosay guided approach, reverse biosay guided approach, and replication, UPLC, MS guided approach, and other approaches. So, coming to biosay guided approach, we have developed our own biosay guided approach by by using the reverse space 18 column chromatography, the elution of methanol and acetone. By 6 fractions will be developed, and by screening the active fraction, the isolation of the lead compound will be involved. After isolation, synthesis, chemical modification, mechanism of action studies, and in vitro in vivo studies will be taken based on the activity. So this is one of the example piper species. We know pretty well about the piper species: piper longum, piper beetle, piper argentianum, piper nigrum, piper chaba, and all those things. So as part of our program, we have screened different piper species for anti-cancer activities as well as aldose reductase inhibition, that is nothing but diabetic retinopathy. So we came to know that methanolic extract of piper chaba showed cytotoxic activity, and chloroform extract of piper chaba showed moderate activity against the ARI inhibition. So that active fraction we have taken and isolated the compounds from the fraction, and these among these 7 compounds or 5 compounds are new compounds. And after isolation, these pure compounds were again tested for their cytotoxicity against the cancer cell lines. Here you can see the second compound chapmate G showing good activity against the colo 205 cell lines, almost on par with the standard. Similarly, this showed moderate activity. And these are the NMR structural characteristics we observed while characterization of the structures, and finally confirmed through the mass spectrometry fragmentation studies, where we came to know that this dimeric piperamide is forming by the Diels-Alder reaction of this monomeric piperamides, piperin and fragiramide. And the coming to the chloroform extract against the ALR2 inhibition, and we have isolated different class of compounds, piperamides and lignans and all compounds. Among this pipelartin showed moderate activity with 160 micromoles, and also we have isolated this compound in gram quantities. So we thought of making derivatives or chemical modification to get value of this the add value to this compound. For this, before that, we have just did the analysis of the structure and compared with the marketed drugs where known ALR2 inhibitors, and we came to know this diamide functionality seems to be common in our lead compound and other market drugs. So we thought of keeping intact of this diamide functionality and playing around this aromatic functionality and this double bond. For that, initially we thought of introducing the heterocyclic moiety, indole moiety to this double bond, and for this we screened different catalyst, Lewis acid catalyst, and finally we optimized with iodine 10 mole percent, where it is giving 10 per 80% yield, and dichloroethan is 80% yield. With it is optimized condition, we performed the Michael addition reaction of pipelartin with different indoles and prepared mono and dichledex. Here all the products were screened against the ALR2 inhibition. Here the dimichylerics are showing potent activity almost 4 micromoles, almost equal to the standards. Similarly, the other derivatives also prepared, but unfortunately these are not showing the activity. The only Michaelidex are showing the parent original parent molecule activity is 160 micromoles and derivative activity is 4 micromoles. That means the activity was enhanced 40 folds. So this work was patented. Still we are working to add some more pharmacophoric tiles and pharmacophoric tags to enhance more of the activity. So similarly, the another plant called Premna latifolia, which is one of the ingredient in famous formulation called Dashamol arista. That is a formulation of 10 plant roots, and we have taken this plant and isolated 4 new compounds called isotexy and diterpenoids, and these 4 compounds are very potent against the cancer cell lines and almost on par with the doxorubicin. Based on the low yield or existence of low yield in the plant extract, we have developed the synthesis of these compounds and doing the derivatives to enhance the activity and for synthesis the multigram level to for more biological studies. When coming to a reverse biosecurity approach, this is nothing but you take the extract and prepare the extract, you do isolation as many as number of compounds you can, and finally you screen the biological activity. So this is one of the plants, Ipadasa bosphera, where we collected this plant in the Rampachodavaram forest region. And while the interaction with the tribal people, we came to know this plant is part of many utilized by the tribal people for their health conditions and also for the agriculture use, and we came to know from those tribes, and we are interested to work on this plant and isolated many limonoid type of compounds. Many are almost we have isolated 40 compounds. Among these, 25 compounds are new compounds and screened against the cancers and other insecticidals also. And some of the compounds are showing promising antioxidant activity against the different insects. So LCMS guided approach, this is a recent technique where we can use the intervention of the analytical techniques or hyphenated technique for the isolation. What we did is we prepared the extract. This plant is also Trichilia conarides, which is also belongs to neem family, and this is also collected based on the interaction with the tribal healers in the Rampachodavaram region, and we collected this plant and prepared the extract, and by using the HRMS or the UPLC HRMS, we have generated the molecular formulas and molecular weights of extract compounds in the extract, and went to the literature and identified those new compounds and new molecular weights, and we pinpointed those compound peaks, and by utilizing the preparative HPLC, we have isolated the compounds by preparative HPLC, and we confirm the structures by using the different spectroscopic techniques. And for a glimpse, here I gave one NMR and carbon 13 NMR of one compound 1. These are all 6 new compounds isolated through the help of our HPLC, UPLC, MSMS guided isolation. Similarly, this is a lichen where the red part, this is a thallus. We have collected this thallus red part and isolated the 6 compounds but through the HRMS, UPLC, HRMS guided isolation, and we have screened for the activity, DPPH and other activity. These are all showing moderate activity. So for the classical isolation, Usnea longissima is one of the important lichen species, which is also called old man beard, and this is also part of the its utilization from ancient times in India. Analgesic, cardiotonic, stomachache, wound healing properties, crude extracts by tribal community to treat fever and bone fractures, and we have isolated by using the classical chromatography procedure by using the different hexane and ethyl acetate and hexane and acetone system, isolated these 4 compounds, and first time we have developed the crystal structure of barbatic acid 21, and this is showing good activity against the A549 cell line, almost more potent than the doxorubicin, And we moving forward, we also studied the flow cytometric analysis, cell cycle analysis of barbatic acid, and staining assay and NXGene assay, and we came to know that this 20 compound 21, that is barbatic acid induced cell death by apoptosis, and confirmed that by immunoblot assay that cell death through nuclear damage and induced apoptosis by robust cleavage of PRP protein. And to evaluate to characterize the minor compounds which are in the ppm level, we have taken the help of UPLC qt of MSMS. What we did is we have generated molecular weights and molecular formulas of those minor compounds, and characterized the almost 20 to 30 compounds by using the Mach fragmentation pathways. And these are the structures of the compounds proposed based on the mass fragmentation by MSMS fragmentation. So here I gave some of the fragmentation pathways where where which is involved in the loss of key. This is the blue colored is a key fragment involved in the formation of this compound, and real retrodyl salt reaction and McLaughlin. There is a mass fragmentation rules are well defined in the mass spectrometry. So based on by utilizing those all fragmentation rules, we have characterized by using those fragments. So finally, I would like to thank my director for his enormous support, and my guru Dr. J. Madhusudan Rao. Because of his blessing only, I am in this working in this unique area of natural products, and not least my student force. These students have completed their PhDs, and now they have settled in different countries and different pharma. And these are the present group working in for their pursuing their PhD. And not least, and I would like to thank different funding agencies where they have supported me to carry out my research: DST, DBT, ICAR, and CSIR. And before closing, just I would like to explain about our institute, Indian Institute of Chemical Technology, where it has been established before India's independence, and we have different expertise, particularly the synthesis of the drug intermediates and development of APIs, active pharmaceutical ingredients, and working on different oils and technology, lipid science and technology. And happy to inform you, tell you that the 70% of the rice bran oil technology was utilized by IACT developed technology. Similarly, development of heterogeneous and homogeneous catalysts and genetic chemistry, DOSL, diversity oriented synthesis lab, development of APIs and fine chemicals, agrochemicals and fluoroorganics and pheromones, and natural products laboratory where I am working in this building in the first floor, and which is also well supported by different analytical techniques, NMR, MAS, and XRD, and different pharmaceuticals, chemical biology, biological screening assay, and also, of course, chemical engineering. And I would like to once again salute the pioneers of Indian scientists who sacrificed their life by working in the natural products area: J.L. Simonson, Ramnath Chopra, Salamuddin Siddiqui, T.R. Sheshadri, K. Venkatraman, T.R. Govindarachari, very well known for neem chemistry, Asima Chatterjee, Susank Chandra Bhattacharya, and Sukhdev. Sukhdev is known for Google steroids, and he is a living legend of natural product chemist. Thank you, one and all, for your patience. And once again, thanks to Dr. Lakshman Rao, my friend, for giving the opportunity to showcase our recent work and emphasize about the importance of the natural products. Um, Thank you, one and all.
So thank you, sir. There is a quest from participant, sir,
Sure, definitely I will take.
in which accepts aspects the usage of drugs in India were differentiated from other countries.
See, coming to lichens. See, lichens are very famous in as a nutraceuticals in the Europe. Even in India, if you go to interior forests of interior areas of Rayalaseema, lichens are very well sold in retail shops as a mixed lichens as a nutraceuticals. So similarly, the other drugs also, even the other herbal drugs also known in the different countries, and of course, some of the extracts or some of the plants are exporting to other countries to develop drugs in those countries. I think I have answered. Otherwise, you inform me again. I will tell you. I will clarify.
Thank you, sir. So thank you for an effective delivery speech on various aspects, importance of natural products, standardization by various analytical instruments, and even you just touched the different sources, natural resources in global health importance especially. Now I would like to invite Dr. A. Lakshman Rao Garu, convener of the program, to have his words.
Respected chief guest of today's valedictory session, senior academician, Professor K. Krishna Reddy Garu, Honorable Registrar, Krishna University, Machilipatnam, eminent speaker of today's session, Dr. K. Suresh Babu Garu, and the coordinator for the online STTP program, Dr. P. Ravisha Garu, participants from various colleges. A very good afternoon to one and all for the valedictory function of 3-day online STTP program on role of phytomedicines in global health, organized by Department of Pharmacognosy, VV Institute of Pharmaceutical Sciences, Gudlavaledu, Krishna District, Andhra Pradesh, in collaboration with Krishna University, Machilipatnam, Andhra Pradesh. Now, I hand over the session to Dr. P. Ravisha Garu to introduce the today's chief guest, Professor K. Krishna Reddy Garu, to the participants. Over to Ravisha Garu.
It's my honor to introduce today's registrar, uh, Dr. K. Krishna Reddy Garu, Registrar, Krishna University, Machilipatnam. Sir is having a professional experience of 34 years in both academics as well as in research. He is the Chief Scientist, Japan Agency for Marine Science and Technology, Japan. He is the member and faculty, International School on Atmospheric Radar. He is the researcher, 10th Indian Scientific Expedition to Antarctica. He is the Young Scientist, International Union on Radio Science. He got AP Scientist Award, Andhra Pradesh Council of Science and Technology. He is the Secretary, Indian Association of Physics Teachers. He got AP State Best University Teacher Award. He awarded Dr. Palle Ramarao Award for Physical Sciences. He is the Fellow, Institute of Electronics and Telecommunications, New Delhi. He is the Founder Fellow, Andhra Pradesh Academy of Sciences, Amaravati. He is the Fellow, Telangana Academy of Sciences, Hyderabad. He is the member, High-Level Committee of Experts for Establishment of Doppler Weather Radar over India, India Meteorological Department, New Delhi. He is the member, Technical Committee, Karnataka Government, Cloud Seeding, Bangalore. He is having 8 research grants. His publications are 136, presented in 187 papers in international and national conferences, and invited talks are 92. Sir supervised 17 PhDs, 6 MPhil, 18 MTech projects. He authored 6 books. He grabbed 10 awards, and a few of them are gold medal awarded for the best research paper at the National Space Science Symposium, Physical Research Laboratory, Ahmedabad in the year 1992. He owned Young Scientist International Union of Radio Sciences, Lille, France. He is a Secretary, Indian Association of Physics Teachers, Andhra Pradesh, Telangana State since 2009 onwards. He is the Best University Teacher, Andhra Pradesh Government Award, which is awarded on 2012 Hyderabad. So he is the executive member of Andhra Pradesh State Knowledge Mission from 2015. He is the life member of various associations like Indian Association of Physics Teachers, Instrument Society of India, India Meteorological Society, National Environmental Science Academy, the Indian Science Congress Association, Association of Agro-Meteorologists, Anand, International Association of Engineering and Technology, and the Indian Society of Technical Education. Now, I would like to invite His Excellency Dr. K. Krishna Reddy Garu, Registrar, Krishna University, Machilipatnam, to share his valuable words. Sir, sorry, sir, it's not audible, sir.
Sir, can you unmute your mic?
Yeah, yes, sir.
Hello, I am audible to
Okay.
you.
Oh,
Yeah,
Yes,
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 sir.
sir.
sir. You're getting, your voice is getting, sir.
It is audible, sir.
I am audible.
Yes, sir. You're audible, sir. You're audible.
Hello.
Hello,
Sir,
sir.
you're audible, sir. You're audible.
Ravisha garu.
So here you select file upload format and but I want to receive
Krishna Reddy, sir, you are audible now. You can speak.
PDF, new drawing for the file format. I don't want to receive those data format. So there's a way how you can
Hello.
select
Oh,
Hello,
the
sir,
sir.
you are audible now. You can speak.
uploaded.
Okay, ma. I am sorry for the technical snag. It was
It's
happened
no
here
problem, sir.
due
No
to the
problem. No
volatility of the
problem, sir.
internet here. No, 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 no. I must say sorry for you. In abruptly, I was left from this place. Uh, Really, I was overwhelmed to be in the valedictory function. As a researcher, I have seen that though it is a very compact online webinar, was made by the VV College and one of the best webinars so far I have seen here. Today's speaker, I was with that. The speaker was also giving so much of wealth of information, and really for the, as we know in the Indian contemporary research, if you see the quality of the research is diminishing due to the three factors. First factor is there is no such great intense incentives is given to the researcher who is doing the research in the private and also uh, in the state universities, and also then this and also the research curriculum was made as a very very primitive way. The research itself has its own flavor. If really you know how to cook a meal, if you know the where the raw material is produced, then only you can understand the research. In India, the basic research was so good about 3 decades ago. Now we are going in the applied sciences, applied technology, applied engineering, and applied pharmacy. And so we are not having the fundamentally thinking as a research, as in like platinum. So we have to make research in a such a way, the first guide must be in a position to deliver the goods to the researcher, the scholar. If we can train him, if we can bend him in a such a way, he will deliver the goods in a such a way that the
Sir, again there is a problem in sir's side.
Sir, the net connection is poor in our side, sir. Please check it, sir.
Sir, principal sir, sir is gone out from the stream. May he need to add again.
Okay.
Krishna Reddy sir, now you are on online.
uh, sir, Lakshman Rao Garu,
Yeah,
again,
sir.
sorry.
Okay, okay, no
Our
problem, sir.
our internet seems to be very volatile due to the external power failure.
Okay, sir. Please.
So I will make it as a registrar. Have to rectify this. I will do this hopefully by within a fortnight. Thank you, sir.
Okay. Okay, sir.
Now,
Please continue.
as a researcher, the fundamentally we see that nowadays I have seen many research theses. They are below par with the Indian standards. Why? What made this to be like this is a fundamental question to us. Nowadays, there are number of publishers who can publish a paper overnight for couple of thousand rupees. ISSN number bar ISSB number are these are not peer reviewed, and they have the some of them are maybe in the scopus, some of them are may not be in the scopus, and care journals. Some of them will join in the care journal for a half year, 1 year. Biannual they will left from that place, and plagiarism checks, originality. These are all coming down. Only it can be enhanced when the government gives like Vidya Divana, research Vidya Divana అన్నది మనము if we can inculcate a fellowship, if we can assure a fellowship to a student invariably for a PhD student, incentives are given to a student and a job nearly assured a job, then only the research quality, the research quantity and ability, research and the beliefness amongness oneness is definitely will be again revived back in the Indian society. If you see globally, if you send your paper to foreign reputed journal, what will happen? They suspect our data. They say that your data is fictitious, is cooked up, though we do very systematically, honestly. So we have to come up. If you see, China was behind us, but China made a policy. China encouraged a research in a big way. In the GDP they have given 14%. We are not even giving the 7% of our GDP for research and development. So if really, if we can make for a student with a fellowship and the teacher with his ability, if he can do fundamental research, practical application, and the pharma or the industry application, and for the innovative research, definitely we will be in the ahead of other countries. If you see the Nobel Prize, if you see even the Indian Nobel Prize, Sanswarup Bhatnagar Award coming to Andhra Pradesh is nowadays diminished. We cannot count the number also. And if you see the reputed institutions, are they are able to publish the good papers because they have research funding. If you want to publish a research paper in a paid reputed journal, in American journal or in a European journal or in Scandinavian journals or in the East Asian journals, it is extremely difficult for you to raise the funding. The funding is a question. So I saw the last speaker, Suresh Garu, he was very nicely pointed out. I have seen his group, I was so overwhelmed. He could able to produce such a big group. I was, from my bottom of my heart, I salute him, because nowadays it is extremely difficult to send that team. He said that some of them are nook and corner. Globally, they are spread. So really, sir, heads off to you making such a pioneering research. So we need such a Suresh's, not a hatchy patchy. We need the spread like everywhere. In institute, at least we should have a couple of or more than that. Then only in India we can go ahead with the research. However, I don't want to take much of the time. As a research, this is my researcher as is my agony. Though I am now a non-teaching fellow, still I love to learn. I am still learning. I am now learning artificial neural network for the aquaculture, and also the effect of evapotranspiration, and also the aerosol effect on the aquaculture production. I am very happy. I sincerely appreciate the team headed by Lashman Rao Garu, and our deputy and other members, and also our varsity vice chancellor KB Chandrasekhar Garu. So they made a team and they made a very good program, and hoping that in near future we will have more cooperation and real productive research through Lashman Rao Garu. I know Lashman Rao Garu is a researcher, though he is in the uh, institute. Still, he is above par with the university lecturers. I urge him to be in the mainstream and take more fellows, do much more productive research in the near future. And also not only good to your institute, also to our Krishna University. The Krishna University still we need to make further progress under the dynamic leadership of our Vice Chancellor KB Chandrasekhar Garu. So you people will be definitely supportive to us, and thank you very much for inviting me to be in this August function. Uh, I sincerely congratulate the team. They have done wonderfully well. I am extremely sorry for my off and on for the several 3 or 4 times. I beg pardon from you. Thank you very much, one and all. Thank you, one and all. Thank you. Thank you, sir.
Thank you for your valuable advice and inputs on this occasion. And we feel an immense pleasure for your presence in this occasion, sir. Thank you a lot. Now, I would like to invite Dr. A. Lakshman Rao garu to share his words in this valedictory.
On behalf of VV Institute of Pharmaceutical Sciences, Gudlavalledu, I would like to take this opportunity to express my wholehearted gratitude to our mentor and senior academician, Professor K. Krishna Reddy garu, Registrar, Krishna University, Machilipatnam, for sharing his valuable time and giving excellent feedback about the online short-term training program with us. And my sincere thanks to another senior eminent research scientist, Professor Dr. K. Suresh Babu garu, for his intellectual talk on this August occasion. My foremost thanks to Krishna University Machilipatnam authorities for collaboration with us to conduct online short-term training program on role of phytomedicines in global health. On behalf of management, principal, staff and students of VV Institute of Pharmaceutical Sciences, Gudlavalledu, I would like to take this opportunity to thank Honorable Vice Chancellor, Professor KB Chandrasekhar Garu, and Registrar, Professor K. Krishna Reddy Garu, and Head Department of Chemistry and Pharmacy, Dr. D. Ramashekar Reddy Garu, and the advisor, Dr. D. Sivasai Kiran Garu, for their kind support for organizing this online STTP program in a very good manner. My heartfelt gratitude to resource persons in day one, Dr. V. Gopal Garu, Professor and Principal on Registrar Academic, College of Pharmacy, Mother Teresa Postgraduate and Research Institute of Health Sciences, Puducherry. In day two, Dr. V. Nagalakshmi Garu, Joint Managing Director, Imis Pharmaceuticals Private Limited, Vijayawada. In day three, Dr. K. Suresh Babu Garu, Principal Scientist, Indian Institute of Chemical Technology, Hyderabad, for their excellent deliberations. And my heartfelt acknowledgements to members of our management, Dr. V. Nageshwar Rao Garu, Chairman, Sri M. Srinivas Rao Garu, Co-Chairman, Sri V. Satyanarayana Rao Garu, Secretary and Correspondent, and Sri V. Ramakrishna Garu, Co-Secretary and Correspondent of ANM and BVRSR Educational Society and VV Institute of Pharmaceutical Sciences, Gudlavalledu, for their generous and continuous support in making the event a grand success. And let me congratulate our colleague, Dr. P. Ravisha Garu, Coordinator and Head Department of Pharmacognosy, for her interest and enthusiasm for organizing this wonderful online short-term training program. And I thank Ms. A. Saidatri, Assistant Professor, for providing us the technical support to organize this program. I thank Ms. A.V. Agnapriya, Assistant Professor, Department of Pharmacognosy, for her active involvement in online STTP program. And let me thank our senior staff members and HODs of our institution, Dr. Sheikh Aminabi, Head Department of Pharmacology, Dr. P. Bhargavabhushan Rao, Head Department of Pharmaceutics, Dr. K. Shrikant Kumar, Head Department of Pharmaceutical Chemistry, Dr. D. Sharmila, Head Department of Pharmaceutical Analysis, for their sincere involvement. And I also thank all my teaching, non-teaching staff members of VV Institute of Pharmaceutical Sciences for their active involvement for completing this event in an excellent manner. I especially thank principals of various pharmacy colleges for their support and initiations made by the teaching fraternity and also student community of various institutions in entire India. I thank all the people who are involved directly or indirectly for making the 3-day online short-term training program in a very grand success manner. And finally, I thank each and every participant for their interest, for upgrading their knowledge in participating in the online short-term training program during the COVID-19 pandemic situation. And we value your presence with us and look forward to your continued support in future event endeavors too. And thank you one and all. Have a nice day. Over to Ravi Garu for closing remarks.
My first and foremost thanks to Almighty who is there in all circumstances. I thank Dr. A. Lakshman Rao Garu, principal and convener of this program, online short-term training program, who gave continuous support. And I express my sincere thanks to Dr. K.V. Chandrasekhar Garu, Vice Chancellor of Krishna University, Machilipatnam, who is also my guru and mentor and guides me in every path. And I express my sincere gratitude to Dr. K. Krishna Reddy Garu, Registrar, Krishna University, Machilipatnam, for the acceptance of collaboration with the university and for a down-to-earth nature. Thank you, sir. I do express my thanks to my colleagues, Sai Gatri and Ignapriya, for their support in this program. And I express my thanks to teaching faculty who is indirectly or directly supporting me in all the events. And I do express my thanks and gratitude to non-teaching faculty without whom this program is not possible in smooth manner. Thank you one and all. And there is a small note for the participants. Certificates will get issued within the 30th August of 2020. And all the people have to fill the feedback form to get your certificate. And the feedback form link is already posted in the YouTube chat box, and it is also posted in WhatsApp and Telegram groups. And it is already active. You can post your feedback form so that to get your certificate. Thank you. Thank you one and all.
Thank you, sir. Thank you very much.